The first cases of cholera came just 10 months after Haiti's devastating earthquake in 2010. Within weeks, the disease spread to all 10 provinces of this impoverished nation, making it the worst epidemic in recent history. The illness, which spreads through contaminated water, causes dehydration and, if untreated, can kill within hours. In the 6 years since it was imported by UN troops from Nepal, it's killed thousands and left many feeling abandoned.
The virus was brought here by the United Nations. So every time there is heavy rain, the situation gets worse and it spreads faster. Right now in Port-au-Prince, there may not be that many cases, but in the south of the country, many people are getting infected every day, and the UN still hasn't done anything for the victims.
In August, Secretary-General Ban Ki-moon admitted that the UN was at least in part to blame for the outbreak, but he's yet to publicly apologize. Human rights lawyers have called the UN's initial denials a disgrace. Immunization programs have had some success, but aid is still needed. Officials here say there are two key aspects to bringing cholera under control. One is access to fresh water, the other one is education. And doctors here say they are making progress. But in 2016, it's been reported there have been 700 new cases of cholera each week, in part compounded by Hurricane Matthew. Dr. GABRIEL says the epidemic is now under control, but much work remains.
A vaccine is a strategy, but it's not only the vaccine can resolve the problem. So we have to combine the wash and prevention to educate the population on hygiene and train the people to wash their hands.
There is now talk of UN financial aid for those affected by this deadly epidemic. And Ban Ki-moon, who leaves his job at the end of the year, plans to address the matter before the General Assembly on Thursday. Whatever he says, for many here, it's simply too little, too late. Gallacher, Jazeera, Port-au-Prince, Haiti.